Hello friends, this is Dr. Bhadeep Oja here. I hope you enjoyed my previous videos which I uploaded in the past few days. Today's video is about, as I promised, medico-legal aspects, ethics, consent in dentistry. One of the three topics which I speak apart from practice management and finance in dentistry. So let me just give you a brief introduction about a very commonly asked question. If the patient does not pay, can we refuse the patient a treatment? A very commonly asked question in my workshops and lectures. So we dentists are governed by the Indian Contract Act 1872 also, which means we both are doing a thing. We both means the patient and the dentist are doing a thing on which we have mutually agreed upon in the same term, in the same sense, and on the same thing. So as they say, noble or ethical profession, we just cannot abandon the patient midway. The contract or the say terminology of no payment, no cure will not be or should not be followed by the dentist. So if the patient does not pay, even then we have to complete the task. Yes, we can refuse the treatment. So let's suppose we are doing the full mouth case, or say not exactly an implant rehabilitation, but a full mouth case. We have number of cavities, root canals, bridge work of left and right, and where you are restoring one side first, and on restoring the say one side, you come across that the patient is not say punctual, or is not paying you on time, or is not say following the post-operative instructions, which puts you at risk. So the best would be to complete the treatment of the left side and refuse the patient the treatment for the right side. You can't abandon the treatment of the left side midway just because we cannot refuse the patient in between. So I hope I make that point clear. Another point which is very commonly asked in my workshops is that how long do we have to maintain the patient records or the patient treatment records, and what exactly is covered in that? The patient records are to be maintained as per the MCI and the DCI for a period of 3 years. The absolute period is 2 years, and usually we say 1 year of condonation of delay is allowed by the Judge Sahab, or say by the Honorable Judge Sahab, which we always say as my lord in common Indian judiciary language. So 1 year of condonation of delay means under special circumstances it is sometimes allowed. So for that you have to keep a record to be on the safer side for a period of 3 years as mandated by the MCI and the DCI records separately. And it has been mentioned in the DCI revised guidelines 2014 as well. And what do the records include? They include all the CAS records, the case paper, the case sheet, and any photographs if at all. This is for the adults for a period of 3 years. For a minor, let's suppose for a minor you have done the treatment at the age of 5 years. The records are to be maintained till the minor turns major. So what does that mean? That means for a period of for a 5-year-old kid, you have to maintain the records till he is say 18 years old for a period of 13 years. So kindly keep into that point. Another aspect which is very commonly asked is that do the patients own the records? No, the records belong to the dentist, but the patient has a full right to get a copy of the same if he decides to abandon the treatment midway. He has full right to do so, and the dentist has to provide the same within 72 hours of the request. You are not liable to provide the original records, but yes, you have to provide the Xerox records or whatever you have, including the photographs. Of course, you can't provide the casts in such a case, but you can provide the photographs of the casts in those cases. But otherwise, case paper, case sheet, and photographs, whatever you have to provide them, and you can charge for the same. That means you can charge for the Xerox copy or whatever charges you incur, the reasonable charges you have to incur, you have to provide that same. So remember, there are many other aspects which we say when we talk about the standard of care. The courts do not expect us to be Hercules. They expect what a ordinary person would do in ordinary set of circumstances using reasonable skill and wisdom is is expected us to be acted upon in such a manner. So, and I hope the reasonable skill is dealt upon by all. So this brings me to an end of this short video. Stay tuned for more such videos. I'll be taking up consent also and the ethical challenges also in my upcoming few videos. Do subscribe to my YouTube channel, Dr. Bhavdeep Ahuja, and do hit the bell icon because I'll be posting videos very regularly. Thank you so much for patient hearing. I hope you get something. Thank you.